walking through London and I'm having my bloods done now. Going to 76 Wimpole Street. People are staring at me because I'm the only one in London with eyes down and a mask on. But I think I look absolutely fabulous. So as you can see, I'm in the children's room on my own, and that is because I can't mix with anyone. Just hit the visor. I can't mix with a soul, so I'm in the waiting room on my own, having bloods done, just to make sure that the meds that I'm on, because they doubled the dose from last week, see that my hormone levels are rising up, and it's all good for baby.
In and out. Good. Well done, you. You okay?
Yeah, all good.
Perfect. Okay?
Okay.
Right. So,
Yes.
what we are seeing here is your uterus.
Let me switch that around.
This layer inside.
Yeah.
Here is exactly the place where the embryo is implanted.
Okay.
And what I can see
Yeah.
is just a lovely endometrium.
It looks good.
It's lovely. It's
I
not
look
like
healthy.
this.
It looks healthy.
Amazing.
Really?
So, yeah, it's like a textbook.
Amazing sounds the best word in the world right now,
Yes.
going through IVF after having so many
Definitely.
miscarriages. So that's put some of my anxiety
So,
at ease.
you say that's amazing. It just means that this endometrium meets the criteria.
Okay.
and We are having.
Well,
check-assessed
it's a
endometrium.
positive.
Yeah.
I'm going to take that and
Yeah.
digest
It
that
is.
for now.
It's really. I'll show you what we are looking for.
Amazing.
Probably you have heard already about this triple layer structure.
Yes. What we're looking for, you said the 3 lines.
Yeah, that's 3 white lines which
Yeah.
are defining the endometrium from the surrounding area.
Yeah.
And
One
we can see that
very
first
clearly.
one. Yeah.
Yes. Amazing.
That's the second one.
Yes.
And that's the third one.
Amazing.
Yeah, absolutely.
Good.
That's why I said the same word.
You did.
We'll mention them.
What is it?
So, these are called myometriocysts.
Yeah.
But
cysts. I thought I
yeah.
had my cysts removed though.
Not ovarian cysts.
Oh, okay.
Something different. These things, they don't need to be removed.
Okay.
They don't affect anything,
Okay.
either the pregnancy or
Okay.
something else.
Yeah.
So you don't need
So
to
that's
remove
different to
them or-
the cyst that I had surgery for is different to this.
Absolutely different.
Okay.
Right, so you need to check your ovaries also.
Okay.
Right, so that's the left one here.
How's it looking?
Normal, healthy and inactive at the moment, what we are looking for.
Okay.
You see these small black dots which are follicles, but they are tiny and small.
Perfect. Yep.
Yeah, and then the right one. Sorry,
Sorry.
this one is with this cyst here.
That's the
Which
cyst.
is- yeah, that's the cyst.
But the
it's
cyst's
not
gone.
there.
It has the cyst's been aspirated,
I
hasn't
know,
it? Yeah.
I know, but this kind of cyst, they have this thing to collect. It's
Is
not
there any
big,
fluid in it?
there is a fluid and the
Oh.
size is about a normal follicle, so don't worry about
Okay.
this.
So now I'm just relax and let the meds do their job.
Three ampules.
Yep.
So they're quite an oily substance, so make sure it's just at room temperature so it doesn't harden or something like that. And then if you take one out, if you tap the head first, make sure all the medications are down here.
Yeah.
And as you can see, there's a white line around it, so
Yeah.
that means it can be broken at any direction.
All right.
So you hold it here firmly, but not too tight,
Right.
and then just snap off the head
Okay.
or the neck. Then discard the sharps into your sharps bin, and then just leave it. Make sure you do this on a table, yeah.
Yeah.
So I
Yeah.
won't do it in right now.
Okay.
So you take your syringe, and then get your red needle first. So the red needle is blunt, so it's not. Then syringe, get your needle, put it together. Then no need to turn it upside down yet, because you might just spill it. So just do this one and then suck out the medication. So you should have about 1 ml. It's fine if there's any air there. Then discard this one, the empty one, and then you can just discard this one into your sharps bin. And then take one of your green needles, and then you would have the medication here and a tiny bit of air there. So what you'd want to do is just remove the air, push it out.
Because I'm isolating on my own, I'm not going to have anyone to put it in my bum.
Correct. So you can just do it
on my own.
Yeah.
And alternate legs each day.
These sections. So let's say that's the knees.
Yeah.
So you go for the middle outer.
Middle outer.
Yeah.
Every time.
Every time.
Okay.
Pinch the skin.
Yeah.
Make sure that you've got a good amount of muscle in between your fingers.
Yeah.
And then puncture. Like that. The needle has to go all the way in, yeah?
Oh my gosh, okay.
Then what you do as well is you can release the skin, then hold the needle here, and then what you want to do is pull the plunger back a bit. Now what we're doing is that we are checking if you are in a blood vessel or not. So if you're in a blood vessel, of course you'll have blood here. So we'll get to that one later. So if there's no blood, you just give the medication straight away.
Okay.
Now, if for example you've got blood there.
Yeah.
So what you just do is you draw back the needle a tiny bit.
Okay.
You don't need to remove the entire needle from your skin or from the muscle. Yeah. Then take the needle out, apply a good amount of pressure, especially you're on blood thinners, and then discard this into your sharps bin. We'll let you know when you'll be starting it. So depending on how your blood test results are, we will let you know.
Okay.
Yeah.
So I'm officially in the car now. I've just had all my meds done, my scan, I've had my bloods done, and I've gone home with my meds. This is my bag. So all of this is filled with my meds and just some more here as well. Yeah, home time. So we're home. I was out since 8 this morning, had my bloods done. We'll wait to get those results any minute now. I should have them. So fingers crossed, pray for me if you believe in Jesus, God, spirit world, spirit animals, whoever, help me. Hopefully my estrogen levels have gone up, which is what we want. Womb lining looks amazing, as you heard on my news stories from one of the nurses. So all good. And pray for me, people. Pray. Next week will be embryo transfer. And then it's the dreaded wait to see that all of this pain has worked. Another thing to say, injecting, normally you would be living with someone who would be doing the injections in the bum. It's a very big needle in the bum muscle, but I'm on my own. So the nurse Adrian has had to try to show me that I need to inject. So the quad muscle, and it's a massive needle. A bit worried about that, but I'm injecting myself anyway with other meds, so I'll be now taking my steroids. I feel like, I don't know if it's in my head, but the steroids give you a moon face, unwanted hair, yay, sweating, it's not very nice, again, woohoo, Progenova, which is a female hormone. Don't know why I touched my nose just then. Blood thinner in an injectable form. Aspirin. Have I missed anything out, Lola? Calcium tablets, vitamin C. Obviously my prenatal. That's pretty much about it. So I have completely bombarded you with my stories from A day in the life of Nicola. Welcome. Having hot sweats, so I'm going to go and have a cold shower. My body kind of thinks it's going through the menopause. Yeah. Don't really know what else to say. Have a lovely day. Enjoy my story. I hope it helps someone.